My name's Rodrigo. I've been working at Reach for Recovery about 9 months now. This is my first job after graduation from my Master's of Public Health. I work majorly in the MAT program at Reach for Recovery while also helping clinicians with their outpatient, intensive outpatient, or residential programs as well. So my position is the substance use disorder case manager. A majority of my responsibilities is basically answering questions, getting referrals from clinicians, from clients that are interested in MAT. They usually start that conversation with their clinician, like saying like, hey, I'm interested. What can I do to get into this program? Then they're referred to me either through phone call, in person, and then I basically try to get them in as soon as I can to meet with our nurse practitioner, Linda Rossman. She's the one that sees our clients and does the majority of the work in regards to medication, dosing, and all that kind of stuff. The MAT program has been up and running for about 6 to 7 months now. We're seeing about 40 plus clients, and we've seen a total of about 60 clients. We have medications available such as Suboxone, Vivitrol, Sublocade, and any of the other medications used for alcohol dependence, such as Antabuse, Acamprosate, and disulfiram. That's a majority of the work that MAT does at Reach. Every client's going to be different. Every client's going to be in a different part of their life. We have like a wide spectrum of clients that we see. Some of them are at the very low point of their lives where they're either homeless, they don't have a job, their kids are staying with their grandma, so they can't really see them that often. We have clients that have jobs that are, functioning in society. They have families. It's going to be very different from every client that you see. You are kind of playing a bunch of hats in the organization while you're helping clinicians with their clients as well, reading their notes to see kind of what's going on in their lives, seeing updates, and kind of bringing that up into the appointment when we see them for MAT. We've had clients that we've been seeing ever since the program first started back in July. I present on MAT for like every month at residential or intensive outpatient programs for our clients. And I tell them the same answer when they ask me how long do I have to stay on my medication or how long do I have to stay in the program. And research shows that we see benefits in clients after a year while they're in the program. But there's no definitive recommendation of how long somebody should be on MAT. As long as it's providing them benefit, we don't see a reason in taking them off the program. As long as the client feels like they're ready to taper down or ready to get off their medication, then that's a conversation they should have with their provider to let them know, hey, I think I'm ready to get off my medication. Do you think it's a good idea? Talk to their clinician to see if they think it's a good idea. And that usually takes about 1 or 2 years of when clients start feeling that they're ready to discharge from the program. What the research shows online as well is that if you're on MAT, you're more likely to stay in your program, whether it be outpatient and MAT or intensive outpatient and MAT. I'm actually kind of brand new in the field, in the population, in the program itself. We haven't even gotten there where we would recommend somebody out of MAT where they're ready to be discharged from MAT. But kind of what we do here at Reach for Recovery, when they're in intensive outpatient, we usually refer them to outpatient programs. We have like a skills group that people can attend, an early recovery group. We have a women's trauma group as well that we're recently starting. And those are kind of like the lower level programs that people end up going into once they're finished with those higher level programs, such as residential and intensive outpatient. So I would say we're still in the works of where we would refer people after MAT. I love that question because I have a lot of stories and I see a lot of clients doing really well when they're on MAT, kind of like the clients that we've been seeing since July. We kind of first started the program in our residential program at the Women's House. We have about maybe 4 clients that we still see that have been at the residential program back in July. And now we're seeing them as an outpatient client here at our office. One of them is starting their own business, have put in a lot of investments in getting tools. She's been doing a lot of personal goals of taking care of her child, getting ready to be discharged from probation. We have another gal who is buying her own house now, has a really stable job, was working 2 jobs. Yeah, there's a lot of milestones that people reach while they're in MAT, whether it be jobs, fixing relationships with their families or significant others. Going back with their children is a big thing that clients like to talk about. Yeah, all those things, we see all of that while we see people in our program. So I want to say that MAT is very shocking to me that people aren't aware that there's medication out there for people to help with their cravings and withdrawal symptoms. Sometimes counseling by itself is not sufficient for the client. Sometimes, they're constantly bothered by the craving or the thought of their substance abuse in the past. And then it makes them not focused into the program that they're admitted to. So if they're doing counseling and MAT at the same time, which is medication and counseling, they have a much easier way to stay in their program and to focus in their program and to continue with their personal goals, whether it be finding a job, fixing those relationships, or just other goals that they have that they want to do during their sobriety.